So today we will discuss about a very important topic, vertigo. Basically, differential diagnosis. What all diseases we see vertigo? Vertigo. What does vertigo mean? Vertigo is basically a spinning motion. During our practice, we see a lot of patients coming with vertigo, and this difference between dizziness, giddiness, they all present with pre-syncope like features, but vertigo has a spinning motion mainly. Everything around you feels like spinning. Basically, patient describes as a spinning motion. So let's discuss what all diseases. So all these differential diagnosis has to go through your mind. Basically, the first one we'll discuss about is Meniere's disease. Meniere's disease. There will be a family history. They will have patients with a family history in Meniere's disease. What does it basically? What is the problem in Meniere's disease is that there'll be accumulation of endolymph. Okay, there'll be accumulation of endolymph, and so let me clear some anatomy, the basics. Let me brush up some basics before that. The anatomy of the ear is divided into three parts: outer, middle, and the inner ear. Basically, the inner ear contains the cochlear nerve, vestibular nerve, and cochlea. The structure here is called the cochlea. Okay, and it has the vestibular nerve, cochlear nerve, like we call it the CN8, and we also have the semicircular canals. And in the middle ear structure, we have the three bony structures: incus, stapes, and malleus. And then the outer ear contains the rest of the stuff. This is the ear canal, and then straight it goes to the outer ears. You have the helix, ear lobules, concha. This area is called concha, and rest of it. So what happens in the labyrinth? So what happens here is there's an accumulation of endolymph in the labyrinth. Labyrinth is basically the inner ear structures, as we discussed before in the labyrinth. So what happens? What do the patients feel in Meniere's disease? What are the clinical features? In clinical features, you see patients having fullness in the ear because it's filled with the fluid, the endolymph, which is there in the semicircular canals and basically the inner ear structures. So you hear patients saying fullness of ear, and there'll be vertigo, like we discussed, vertigo, but it's acute, it's sudden in onset, and you hear patients saying that they have a tinnitus. What is tinnitus? Tinnitus is basically a ringing in sensation of a ringing. Patient says that they find ringing in their ears, in the ear. Okay, and also importantly, patient will have hearing loss, gradual hearing loss. Okay, hearing loss. So this is about the Meniere's disease. So it's similar to Meniere's disease. There is also acoustic condition called as acoustic neuroma. Basically neuroma, it's tumor where it is the benign tumor. It's a benign tumor, not malignant. It's a benign tumor of the cerebellopontine angle, CP angle. Okay, it's a benign tumor of the cerebellopontine angle. So they arise from what? They arise from the Schwann cells in the myelin sheath. What is a myelin sheath? Myelin sheath, basically all these nerves are covered in myelin sheath. So they are the tumors in the myelin sheath. Okay, myelin sheath, also called as myelin sheath. Okay, so this acoustic neuroma is also called as vestibular schwannoma. Okay, vestibular schwannoma. All right, so this is it. So what is it? Both of them are have a similar condition, but how do you differentiate it? So both of them have vertigo, like we said. Both of them have vertigo. So let's Meniere's disease and Meniere's disease versus acoustic neuroma. So what does it have? Both of them have vertigo, like we said. Both of them have vertigo. Both of them has deafness, and both of them have tinnitus, ringing in the ear. So what is the difference? In Meniere's we discussed, the patient will come with ear fullness. Okay, and in acoustic neuroma they will have cranial nerve involvement. Okay, basically it's a tumor, so there'll be cranial nerve. Also, patient will ataxia, loss of balance. Okay, loss of balance. Patient will have ataxia. So this is the difference. Okay, this is the difference. Now, let's discuss about another differential diagnosis. That is Meniere's is over. We'll discuss about the next differential diagnosis. That is vestibular neuritis. It's inflammation of the vestibules. Okay, vestibular nerve. It's an inflammation of the vestibular nerve. It's an inflammation of the vestibular nerve. Okay, vestibular nerve. So even this will cause vertigo. But important thing here is there is no hearing loss. It's just an inflammation, no hearing loss in this. Okay, no hearing loss. But similar condition is labyrinthitis, inner ear, inflammation of the vestibular nerve, along with inflammation of vestibular nerve plus the labyrinth, inner ear. Okay, so there's vestibular nerve is involved, also a labyrinth is involved. Labyrinth, like I said, all the inner ear structure like cochlea, vestibule, semicircular canals, all these are involved. Bony labyrinth, also membranous labyrinth. So when you go to the anatomy, you can brush up your anatomy later. Okay. Now let's continue with this. So what did we say? This is the inflammation of the vestibular nerve, and here is vestibular nerve plus the labyrinth is also involved in labyrinthitis. So what is the difference then? Like we said, there is no hearing loss in vestibular neuritis. So both of them, what are the similar conditions? Both of them will have vertigo, and both of them will have vomiting, and there will be both of them will have a preceding viral upper respiratory tract infection. Both labyrinthitis and vestibular neuritis, both of them will have 3 of these conditions. So the difference is there's no hearing loss in vestibular neuritis, but there will be hearing loss in labyrinthitis. There will be hearing loss in labyrinthitis along with tinnitus. That is the ringing sound. Okay. So this is the difference. So again, I'll explain it. Like both of them will have. I can explain that both of them will have the vestibular neuritis and labyrinthitis. Both of them will have vertigo, which is acute in nature, vertigo. They'll have vomiting, and they'll have viral upper respiratory tract infection. Okay. So what happens is, how do you differentiate then? If it's without hearing loss, then it is vestibular neuritis. But if with hearing loss, then it is labyrinthitis. Okay, so this is the difference. Now let's discuss about another condition with vertigo, that is vertebropatellar insufficiency. Okay, and stroke. So there's arteries involved, the pica. Which artery is involved? Pica. Posterior inferocerebellar artery is involved. This also has vertigo, which is acute in nature. And main thing is it has ipsilateral horners. What is horners? What do you find in horners? Horners syndrome. Miosis, which is the construction of pupils. Ptosis, which is drooping of the eyelids, and anhidrosis. What is anhidrosis? Which is basically no sweating in that side of the face. Okay, in horners, ipsilateral horners. Also, there is ipsilateral loss of facial sensation. Okay, loss of facial sensation. Also, you'll find in vertebropatellar insufficiency, there is also paresthesia, numbness in the limbs. Okay, numbness of limbs. Also, you can find cranial nerve palsy, which is ipsilateral. Okay, everything is ipsilateral here. So there's another condition called as the lateral medullary syndrome. This is also called as Wallenberg syndrome. Is also called as the Wallenberg syndrome. This is ischemia. What happens here is ischemia, loss of blood supply, constriction. Okay, ischemia to the pica, posterior inferocerebellar artery, and just a minute, guys. So there is ischemia to posterior inferocerebellar artery in the case of lateral medullary syndrome. So the pica supplies the cerebellum. Okay, so when cerebellum is involved, what happens? You find patients having dysarthria, which is difficulty in speech, nystagmus. Okay, your pupils. They go left and right, and vertical nystagmus, that's horizontal nystagmus. Also dysmetria. You cannot calculate the distance. Problem in calculating the distance. So all these problems are involved in lateral medullary syndrome, and this is it. Now let's discuss which is a very common cause of vertigo, which is the BPPV, benign, which is benign paroxysmal positional vertigo. Benign paroxysmal positional vertigo. So most common cause of vertigo. How do the patients come? Patients come with complaints of recurrent vertigo attacks. A lot of patients come. Especially in my practice, I've seen a lot of patients coming with vertigo. Middle-aged, elderly, a lot of people. So what do they come with? They will have a, what are the clinical features in it? So another important point to be noted is they will not have any without any hearing loss or ringing sound like tinnitus, without any hearing loss or tinnitus. Okay. So what is the main problem here? What is the pathology? How does this cause in patients? Mainly it is, what happens is you have crystals. There's deposition of calcium crystals. In the posterior I've showed you the anatomy before, in the circular canals, the posterior part of the semicircular canals, we have anterior and middle. So the posterior part, there is deposition of calcium crystals, due to which patient feels this vertigo. Okay, so what do they feel? What are the clinical features? They feel this vertigo, brief episodes of vertigo, in tilting the head. While tilting head, or also while getting up from bed, from sitting position. A lot of people say that, and they also feel nausea. They'll feel nausea, and they'll feel, we can see nystagmus. When we check their eyes, we can see nystagmus. And also, how do we diagnose? What is the diagnostic criteria for BPPV? That's called the Halpix, exam purpose, Halpix maneuver. Okay, this one, Halpix maneuver. You can YouTube, go just check the YouTube how do you do this. And what is the treatment? The procedure is called Epley's. Mainly the NT physicians does it. Epley's maneuver. We're confident enough, we can also do it. Okay, Epley's maneuver. So what do they do in this? The crystals is basically, the crystals are misplaced. They're in the posterior semicircular. They have to be in the correct position. So by doing the procedure 2 or 3 times in a particular angle, these crystals falls back into their place, and then the symptoms subside. And also, we will also give drugs like Vertigo, Stemitil, in the acute episodes. And yeah, so this is it. And so now we learned about vestibular neuritis. How do we? They're both similar. BPPV and vestibular neuritis. They're both similar. How do we differentiate? How do we differentiate? Both of them have vertigo. Both of them vertigo. Both of them has vomiting and nausea. And both of them, there is no hearing loss. No hearing loss and no tinnitus. Okay, both of them don't have that. So how do we differentiate in vestibular neuritis? There cannot be nystagmus, may or may not be nystagmus. Okay. And also, main important factor, how do we differentiate? We does the caloric test, which will be reduced. Like we have learned in our medical lectures, is reduced. Okay, we have learned in the medical lectures. Caloric test. You pour the warm water and the cold water, and then you check. Basically, there was a mnemonic called cows. Then what happened in cold water? The nystagmus will be cold, opposite. Nystagmus will be opposite, and in the warm water, it will be nystagmus on the same side. Remember this? The same side. This was a mnemonic. Yeah. So this is how we differentiate PPP and vestibular neuritis. So we discussed about few pictures. I hope you like it, and thank you. And we'll come with another important topics as well. Thank you.